Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is orthopedic problems in primary care. My co-host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan. How are you doing tonight?
Hey, Faisel, it's great to be with you.
It's great to be doing this last live episode with you, Dr. Dan. It's been such a pleasure doing this. I mean, I never would have thought when we first started doing all this that it would become what it's become today.
Yes, but I agree, but we don't want anybody to be confused. We will still be doing these, and the podcast will still be available for people who want to listen to our guests.
Exactly. The audio is what people want. They don't want to see our faces on here. So it's been a fun ride while it's lasted. So our guest for this evening is Dr. Brian Gordon. Dr. Gordon, thank you so much for joining us this evening.
Well, thank you both for having me. I'm excited for our discussion.
Me too. I mean, so I remember from medical school and in residency, there's always we're seeing different kinds of musculoskeletal issues on a day-to-day basis in the primary care setting. I remember in residency when you had the time to be able to do a proper evaluation and to offer different treatments. But gosh, when the schedule gets tighter and tighter and you're just kind of just running through, you find yourself, inappropriately referring out. I remember that years ago, and we see that so much today in the fee-for-service system. But before we get into all that, I'd like to, of course, you're an orthopedic surgeon working with a primary care delivery organization. I'd love to hear a little bit about your story.
So yeah, it's very different from the last 27 years of my life. So I ended up, going to, I'm from upstate New York. I'm from outside of Albany, and I didn't really venture too far from home. I went to college at Colgate. Weather's awful cold there. And from there ended up in Syracuse for medical school. So I certainly didn't head to the tropics. And I stayed on in Syracuse from orthopedic residency. It was a phenomenal residency program. And then did my spine fellowship. I'm board certified in orthopedics, but did my fellowship in spine at the New England Baptist Hospital, part of Tufts. And that was in Boston. And then went back home. My wife and I are both from the Albany area. So we wanted to go back home and raise our kids near our parents. We had the benefit of living near our grandparents, and we wanted that for our children as well. So I entered a large orthopedic group. I was the only spine surgeon, and I was taking general call as well as spine call. And, whenever an orthopedic group gets a spine surgeon in, it seems like everybody's brain is erased in how to handle anything that has to do with back pain. Oh, that's the spine guy. So, orthopedic surgeons are really no different than PCPs. I know my friends that are PCPs, they can judge how good or bad their day is going to be very often by looking at how many low back pain patients are on the schedule. So I was a partner for 7 years, and I found that I had a lot more in common with my neurosurgical colleagues in a lot of ways, and ended up joining 3 neurosurgeons, and we built a spine center. And it was very comprehensive. And in the Albany area, we were the only group to combine orthopedics and neurosurgery for spine care. And we were really a one-stop shop in a lot of ways. We had our own x-ray, we had our own MRI, we had our own fluoroscopy suite. So I could see someone get an x-ray or an MRI if needed, and do an injection. For instance, they had a disc herniation the same day. And our catchment area was very large. We went up to the Canadian border, to Western Massachusetts, down south, close to halfway to New York City, and out west to Utica, so almost near Syracuse. So, it was very beneficial for a lot of patients. But what I found after doing this for about 21 years, 22 years, I was seeing a lot of patients. I was managing our practice. between my nurse practitioner and I, we'd be seeing anywhere from 12 to 1,400 new back pain patients, neck pain patients a year, plus rechecks, surgeries, and the like. So I really started to get burned out. And one of the things that really burned me out was, quite frankly, and a lot of orthopedic surgeons or spine surgeons and neurosurgeons would say I'm a heretic, but there was so much unnecessary surgery being performed, and we were getting the fallout from that. Our group we were getting a lot of second opinions from patients who had failed surgeries before, and day after day of telling patients, there wasn't anything that you could really do. And a lot of times the patients were worse post-operatively than they were pre-operatively because surgeries that quite frankly weren't indicated. It just became very difficult. So I was really getting burned out, but I still felt, at least I was relatively young at the time. I was in my, it was just a couple of years ago. April of 2020, I decided, I talked to my wife and said, well, I'm really not happy with work. And what else can, I feel like I have gas in the tank left. And I became the medical director for New York State Workers' Compensation, which was completely different than anything I had done. And remember, April of 2020, COVID was really just smacking us in the face. And I worked with the lead attorney at Workers' Comp, and my biggest concern was we were going to have a lot of workers that were going to have COVID, and we had no protocols in Workers' Comp for all of New York State, nothing to deal with COVID. So we designed all the protocols and procedures for COVID, redesigned the orthopedic basically pathways for Workers' Comp. And ChenMed found me, and I told them, look, I just got this job, I'm really happy. I transitioned out of clinical medicine into this administrative role. I really like it, blah, blah, blah. I'm not interested. And then lo and behold, I'm on Faisel and Friends talking to you about my experience, right? So I love the idea of, our core model and our mission of taking care of those who need our services the most. I love the idea of VIP care for quite frankly, patients who may never have had a doctor or haven't had a doctor in 30 years or 40 years. And, this is work that other people just don't want to deal with. And, we're running into the fire. So, it was intriguing. And, I started with Chen in October of 2020, and it has just been a great experience. October 2021.
Oh, well, thank you so much for sharing your story. I mean, it was very deeply personal. It's very intimate. Oftentimes we talk about, in healthcare delivery, we're always, and most of the time, you're not dealing with black and white situations, and there's always the gray space. And when you're in a system where there's just so much inefficiency, maybe it's a good decision for the patient, maybe it's not the best decision for the patient. And then when you have to deal with, now we have an entire system that just deals with the consequences of not making maybe perhaps the best or the most efficient decision for each individual person. And yeah, once you start to lose that feeling of fulfillment, especially when we're talking about medicine, it's a bad place to be in. And thank you so much for sharing that. It's very brave of you.
Well, I think it's important for people to be true to themselves, and you can't, as you're saying, you really can't do a good job, especially in a job where people's lives depend on it, if you're not enjoying it.
Yeah.
And I think that's important for people to understand. You got to love this.
So you brought up, it's interesting you brought up the unnecessary surgery because I bet nobody who ever goes through an orthopedic residency or goes through a spine fellowship starts with the idea, hey, I want to do unnecessary surgery. Right? I mean, I think we all go into careers to help people. But what do you think it is about the healthcare system that leads to the unnecessary surgery? Because I'm assuming good people don't just decide to start doing unnecessary procedures. There's got to be something that leads them down that road.